You're very welcome back. Now, the World Health Organization has declared the monkeypox virus to now be a global emergency as attention shifts towards the smallpox vaccine as a possible solution.
Infectious diseases doctor at UCD, Christine Kelly, joins us with more on this alongside HIV Ireland MPOWER Program Manager Adam Shanley, who is with us via Skype this morning. Adam, thank you so much for joining us. Christine, thank you for coming into us. Can you explain to us why the WHO has declared monkeypox a global emergency?
Yeah, sure. So, the first thing to say that monkeypox is not a new virus. It's been circulating in several countries for decades now, countries like the Democratic Republic of Congo and Nigeria. So we know that that's already been happening at fairly low levels compared to what we currently have for many years. But what we're now seeing is outbreaks of monkeypox in countries that wouldn't usually have monkeypox. So that is the first concerning feature. But we're also seeing a very rapid increase in the number of cases, which is also quite concerning. So the WHO have declared an emergency. And the main reason for them doing that practically is that enables countries to mobilise resources and to put more resources and energy into dealing with this outbreak and trying to stem it before it gets worse.
OK, so once the classification changes then, they can mobilise more resources and get more done.
Essentially, that's the main thing. And it gets a little bit more attention and things like that into what is a rapidly kind of growing situation.
Yeah. As part of then the declaration and their observations, they have identified gay men and men that have sex with men as being like the primary spreaders or a primary risks of the disease.
Yeah, so that's right. And actually there's a big study that was released recently over several countries that had over 500 cases described in it. And they showed in that were 100% men that were affected and 98% were from gay, bisexual and other men who have sex with men communities. So it is by and large affecting these people. Those communities.
And in this community, Adam, if we could just have a quick chat with you, what is it that you're hearing from gay and bisexual men? Their main concerns about this, because Christine was saying to us there's 85 cases in Ireland now.
Yeah, I guess we're hearing people are coming forward with kind of odd symptoms, I guess. We've got a really good kind of history of health-seeking behaviour in our community. So when we kind of see something is not right, we have a good history of heading to the doctor or going to our sexual health services. And that's kind of helped in terms of kind of raising the alarm that this is something new. Kind of strange symptoms like kind of spots and ulcers and rashes that are appearing across the body. And so a couple of weeks ago when in London, when the first kind of cases were identified, the kind of red flag was raised. And guys have been really kind of, I guess, conscious, and we've been doing a lot of awareness work for people to look out for those symptoms and come forward for testing. And as Christine had said, you know, the WHO kind of calling it a public health emergency has allowed for those resources to kind of trickle into the community and for us to kind of really bolster our awareness and encourage people to come forward for testing.
And Adam, in terms of the reaction from the gay community, like, is there a risk of like spreading panic and fear? Are people on high alert, or are they in a position to sort of take it in their stride and just ask the appropriate questions and deal with it?
Yeah, I definitely think we're avoiding fear. I think concern is definitely within the community. I mean, there's a virus that's kind of disproportionately affecting our community, and people are experiencing, you know, some people are experiencing mild symptoms and they can kind of get through it, but for some people it's really, really painful, the kind of spots and ulcers that people are getting. So there's definite concern, and I guess as part of our awareness work is that we're trying to encourage people not to panic, to recognise the symptoms and to help them, I guess, with the tips in terms of management and taking, you know, control of how it feels. But I guess, you know, what we really want people to do is just to be on a level of alert. And the more people that recognise that they might have it and come forward for testing, we might be able to control the outbreak.
Because we certainly don't want this to be stigmatised. We've all been there before, where a disease like HIV was stigmatised amongst the gay community. This is not a gay community disease. It's worrying for everyone, but it's not to be considered. Christine, it's not an STD?
So,
or an STI, or is it?
So it's not strictly. We're still working out lots of information about it. It's very new. It's only kind of been behaving like this for a couple of months. So there's still a lot to understand. The discussion about whether it's an STI or not is nuanced. And I think there's a lot more medical information that's needed. But the main method of transmission at the minute is thought to be through skin-to-skin contact, so very close contact with the lesions, the little bumps that come up on the skin. Yeah.
But is it, like you've said, it's been, like, we know it's been around since the 70s in countries, and now it's jumping to places like Europe and America. Now we're getting concerned. Is that not a bit worrying that once it's contained in Africa, we're not paying attention to it?
That's really worrying. For me, that's the main thing, is that when we have these... So monkeypox, until very recently, was referred to as a neglected tropical disease because they're diseases that happen in other parts of the world, I suppose,
we don't pay attention.
that we don't pay attention to.
Yeah.
And so diseases like this are circulating on a regular basis, but they're never really nipped in the bud. There aren't the resources that's put into treatment and vaccines in order to stem those infections. Treatments and vaccines that are freely available, by the way. So what happens is if we neglect those, as the term says, there's then a risk of spreading to other places and then
because they're not
becoming
contained,
a much
they're
bigger
not boxed in,
problem.
and the potential then for spread. Adam, tell us about then the MPOWER Program.
Yeah, so the MPOWER Program at HIV Ireland is a kind of a suite of interventions, resources and services that look to respond to the sexual health and wellbeing needs of gay and bisexual men. So we do a whole host of different things, including kind of low threshold access to testing. So we do testing in our bars and clubs and community spaces. We do lots of outreach, and I guess, you know, monkeypox is a really good example of that, kind of mobilising our community to get out and talk about something that's kind of, you know, affecting our community. So yeah, we do a whole host of things. We make HIV self-testing, Ireland's first free HIV home test as well. So people, gay and bisexual men, can log onto our website and get hold of a free HIV test.
Okay.
So,
and as it pertains then to monkeypox, you're dealing with that. So, do you know, because there's a whole wide range of misinformation on the internet, as well as legitimate, proper information. And one of the sites definitely worth looking
we're
at.
using, and the smallpox vaccine is being used.
Correct.
now.
It is currently being used for people who are close contacts, who are very close contacts
working.
in Ireland.
And it's working.
So we're still gathering information about exactly how effective it is. So we're still in the early days of that. But it's thought to be very effective. Yeah.
But it could have been used in certain countries in Africa years ago, and it never was.
Well, it has been used to a certain extent, but perhaps not the extent that it could have been.
As wide range. Empower.ie. empower.hivireland.ie /monkeypox. Adam, thanks for joining us, and Christine as well.
You're very welcome. Thank you very much.